On any given night in Toronto, about 1,500 youth between the ages of 16 and 24 are experiencing homelessness. And that has prompted advocates to speak out, demanding immediate action.
More and more young people are falling into homelessness, and what we're hearing directly from youth is pretty clear. The system is not built for them. They face long wait lists for shelters, unfair evictions, discrimination, lack of support, and unstable jobs that make it nearly impossible for them to pay rent.
There was a report from the city last month that found about 15,000 people across Toronto are living on the streets at any given time. Shelters are at capacity, and many youth find themselves simply with no place to go. Lisa Tomlinson is CEO of the Children's Aid Society and joins me now. Thanks for being here. What stuck out to you in this most recent bit of data?
I think one of the interesting things, and given the role and the job that I have, was about 10% of the young people who are on the street or homeless or experiencing homelessness have had an interaction with a child welfare agency or have been in foster care. So that's an important piece for us to pay attention to, and certainly data that we've looked at in terms of the experiences of homelessness that young people that we're involved with have.
What would be the influence of foster care that would then perhaps lead a young person to homelessness?
We know foster care is not permanent for young people, for children and young people, so we're always looking at, how do we look at good outcomes for young folks. We know there's a number of transition issues that young people have who leave foster care, education, employment, but certainly housing. Housing impacts that, and it will impact their outcomes in terms of job and education and so on.
We've heard a lot of reports from StatsCan on the employment issue for youth being just terrible this summer. What do you see maybe in 6-8 months down the road as a result of that?
I think we're always looking at, again, it's never just looking at one piece. How do you look at education? How do you look at job? How do you look at homelessness? Access to healthcare services and so on. I mean, what we're talking about are social determinants of health. So how are these all playing and interacting with each other and leading to what kind of outcome for young people?
Can you tell me about, which youth are more vulnerable? I mean, I think as parents sometimes we think, well, this would never happen to our kid or the kids that we know, and obviously that's not true.
So I always say this, there isn't a postal code in this city that child welfare hasn't attended or hasn't been part of. Our workers are out across the city. Certainly, though, we know marginalized young people, marginalized by identity, whether it's 2S LGBTQ+ youth, racialized youth, Black youth, Indigenous youth, youth with disabilities and so on, are far greater likely to be impacted than their counterparts.
And does that stem from the home to start with, or is it some other factor? I mean, you talk about marginalized youth already facing trouble.
I always say it's never one single thing that comes to our, it's not because of necessarily one single thing. It's often a number of things, whether they've experienced neglect. When I think of, again, 2S LGBTQ+ youth, we're seeing a number of them in our care or seeing foster care as their only option. They've been rejected by family, rejected by community, and seeing our system as their option in terms of their safety and being able to be who they are.
Mm-hmm. This, as you mentioned, we hear the term multimodal, or there's a lot of different terms for the fact that this is a big, complex problem. Let's focus in on what you would like City Hall to do.
I think the important piece is having youth at the table, youth who are impacted by homelessness or at risk of homelessness. Having those folks at the table to be able to inform what's happening for them. I think those who are into early adulthood as well, in terms of what was their experience as youth. I think listening to the staff. When I say staff who are working with those youth, whether they're staff who are child welfare staff, counseling staff, staff who provide housing support. And then you need the decision makers to be able to listen and be part of that conversation. Decision makers who can have influence, whether it's on policy, whether it's on practice, whether it's on funding. And you need multi-sectors. It's not just, while it's a housing issue and a housing crisis, you need education at the table. In my experience, you need education at the table, you need labor at the table, you need the multi-sectors at the table. Again, I'm going to say it's not a single solution. It's a need for a collaboration and more work
It's
together.
not just funding, because I think I think a lot of politicians and a lot of the public see that, say, well, are we just talking about spending more?
That may be one of the solutions, or spending differently, but
Does it
it's
have
not
to be
just
more?
It can be potentially more. It can be potentially spending it differently. But I think you'd be, if you didn't have, for example, emergent or the hospital sector in terms of emergency rooms, what's bringing those folks? What's the intersection? When I looked at some of the data last week in preparing for this, what we saw is, young people who were homeless or had precarious homelessness were less likely to graduate, were less likely to have jobs as well. So tying into what this report's talking about, there's multi-sectors at this table, and maybe we just need to also look at different policies or how we do our work.
Lisa, fascinating conversation. I really appreciate your time. Thank you so
Excellent.
much.
Thank you for having us.
That is Lisa Tomlinson, who is CEO of the Children's Aid Society in Toronto.